I'm Jack Parker, and I'm a cornea surgeon here at Parker Cornea in Birmingham, Alabama. Here at Parker Cornea, we do a lot of things. We do just some regular routine cataract surgery and sort of the ordinary procedures that a normal eye doctor would do, but we also do some more complicated things, and that involves some procedures for glaucoma or with intraocular lenses, and also, of course, corneal transplants. Well, you know, normally when you do surgery, you do that in an operating room, and you have these elaborate filtration systems from the ceiling. And not only are those cumbrous and expensive, but also they have this theoretical drawback of they filter clean air down over all sorts of dirty things then onto the patient, which is sort of a self-defeating process. With the SurgiCube, the advantage is not only is this unit much smaller and therefore can be housed in a regular room, but also theoretically provides enhanced sterility and cleanliness because the clean air is produced and filtered directly over the operative site. So not only should it be more economical, it should also be safer and better for the patient. One of the nice things about the SurgiCube is that it's a no-compromise solution. It seems to be better than operating in a conventional operating theater. So all of the procedures we would normally do in a real operating room, we plan on doing with the SurgiCube. That includes cataract surgery and ocular surface reconstruction, and then of course also corneal transplantation. Even for somebody who's totally unfamiliar with the technology, the nice thing is how unobtrusive it is. It is just sort of an environment that allows you a superior sense of sterility, but really there are no fancy gizmos or gadgets or settings, there are no touch screens, there's just an on-off switch, and that on-off switch just regulates the production of clean air. So actually it sort of disappears into the background. It's not something you're managing during the case, it's something that's out of the way that just makes the case better. And one thing we haven't been able to control in the past is sort of the conditions under which we operate. You know, the cleanliness of the air and sort of the comfort of the setting. And here, this gives us the ability to operate in patients in a much more comfortable, easy setting. As opposed to a big hospital operating room, we can do the procedures in our office. And not only can we do them in the office, we can do them more conveniently and more safely that way. So the patients seem to be benefited not only in sort of the ease of the experience, but also probably in sort of the quality of the surgery, because it limits what would be the biggest risk, which is to say, namely, some infection associated with the procedure. When you're doing things in your office, sort of on your home turf, you of course have much more control. And when you have more control, things just flow easier and better. And that gives you much greater ability to schedule the patients to come in when you and they find it the easiest. You're not as sort of confounded by the schedule of people around you, and with the ability then to plan things more carefully, it seems as though it's a much more predictable process. In terms of setup for actual use on a daily basis, the machine literally has an on and off switch, and once you flip the switch, it is set up and ready to be used. You drape the patient in a very simple process that involves just a single drape, which just slots right into the machine, and you're up and running. You know, when you first hear about the SurgiCube, there are sort of these theoretical advantages, and you hear them and you say, okay, well, I think that makes sense. But really, you just have to be around the thing one time. You step into the room and you see it there, and somehow it just makes sense. And so I would say is the SurgiCube just makes sense the first time you see it, that, oh, yes, obviously this is better, clearly this is an advantage. And I would recommend that if you're not sure whether or not the SurgiCube makes sense, just come into a room with one time and look at it, and I imagine that it will make sense to you then. It really doesn't occupy very much space at all, really just sort of sits there in a very convenient place. But one thing that I've been a little bit glad to realize is that the device is very nice looking. It's a very premium, high quality thing. And so it's not something that you're sort of hiding and apologizing for. It's actually a nice feature. It looks nice, it's impressive. The patients like it. I like looking at it, you know, so it's almost a sort of a decorative element for the practice more than it is something that you're wishing were smaller. We are so excited to have access to this new technology and really are very excited to be using it for the benefit of our patients.